Okay, this is now day 14 post-op. I haven't been filling in what I've been doing, but basically been doing a lot of physical therapy 3 times a day. I've been very diligent, um, expanding out what I am doing to try and increase the strength of my iliopsoas muscles, the quads in particular, and the adductors are very tight. I do, when I work out, have a lot of tightness. I won't say pain, but it's really like tightness or maybe a soreness, a heaviness in the groin area. Um, and it's improving. I can tell you that a week ago I couldn't do a straight leg raise. Today I did about 6 or 7 without any assistance at all. And that's a major, major improvement. I'm abducting and adducting, which is sliding my leg out to the side and back, doing that with ease. A week ago I couldn't really do that very well at all. So working hard, it's working. I'm still walking. I'm not doing the long walks. I know it's been about a week since I walked nonstop for about an hour and a half. Really what I find is I sit too long, I get stiff and my butt hurts and the side of my thigh. So I've been tending to walk for half an hour, do my exercises, and try and get up and not sit around, because I really can't sit for more than 15-20 minutes without starting to get tight and stiff. So I'm trying to stay active and concentrate on my rehab. Pain medicines, I know I've been able to go with just Tylenol during the day or sometimes nothing, but nighttime it's just uncomfortable. Been needing to take a tramadol, so I'm still taking that. And actually the past 2 nights, or the first 2 nights, I actually felt like I had good sleep, still waking up at night to have to go to the bathroom. The leg swelling, I've been wearing the stockings until this point, even though compared to what I've seen with other people, my swelling, the edema in my legs has been pretty minimal. But it was more so at the beginning. It definitely was swollen. But at this point, it's very minimal, and being that I'm getting up and moving so much, that's not really an issue. I stopped the Xarelto on day 10, and now for the 1 month I'll be on full dose 325 milligram of aspirin. Anyway, so today was my 2-week visit. So I saw Dr. Radaman and his associate and got some x-rays. I didn't take a picture of them, but I was very pleased. I've got a large femoral head. I'm not sure if it's 52 millimeters or 58 millimeters, but either way, it's pretty good size. And very happy with that. I saw the positioning of the pin and the angles, and I'm very pleased. It was a very good job. The sterile suture, the sterile covering over the wound was removed. I have about a 4.5-inch scar. It's barely noticeable, actually. Wearing bathing suit or even underwear, you won't see it. Put steri strips over it, that'll just come off, but it's a closed wound, so that's not really an issue. So that looks great. And so basically I've gotten through what I was most concerned about the first couple of weeks is infection and deep venous thrombosis. I will be taking aspirin for another month, and then I'll go down to a baby aspirin. I will wear pressure stockings only when I go on an airplane flight in the future. And the other thing to keep in mind, I do have a metal foreign object in my body, so prior to any dental procedures for the rest of my life, I know the American Dental Association says 2 years, but for the rest of my life I will be taking prophylaxis, either amoxicillin or Keflex, but I'll be taking a dose of that before any teeth cleaning, anything, any visits to the dentist. I can't really think of most other procedures. They give you antibiotics beforehand, but that's something that's important. I graduated to a cane, no more walker. The rate I'm progressing, I expect that's going to be another week, and then I'll probably be without anything. Also going to be a little bit more aggressive with the rehab. Now going to be actually crossing the midline a little bit. I'm going to put my left ankle onto the shin of my other leg on the right leg and then slide it up, and we'll see how that goes and try and get some stretching. And eventually I'm going to be trying to externally rotate, which is basically turning the knee out, and we'll see how that goes. But for the next 4 weeks While the capsule's still healing, it's really going to be limiting any stretching. It's really going to be doing more strengthening my quads, which are very weak still, my adductors, which are the ones that pull your leg in, and my glutes, their butt. It's all weak. I'll obviously work on other muscles too to maintain balance. I'll work on my hamstrings and other things. Also, I get to go on the elliptical today. Starting today. I'm not going to be doing to work up a sweat, really for range of motion. That's why I'm going to be doing that for the next month, which is good. I get to watch TV rather than just walk around the house. And I will be able to go outside as long as I'm not taking any narcotics and I don't have a walker and I only use my right foot for driving. Driving is actually good, or I can do it. I can tell you I do have a 2-hour trip to Tampa and I can't sit that long. I really don't I wouldn't make that trip. I didn't as a passenger, moving around and fidgeting in the chair. I actually have the van where I can change the seat, lie it down, move it around. Pretty sore today, mainly from sitting too long. So sitting is an issue. That will get better over the next month, and we'll see how everything progresses. I'll periodically put things on and talk about that. But things are looking really good. I'm really shocked. I went back to the hospital and showed everyone how I'm doing in 2 weeks after surgery, and I've come a long way. And I realize I have a long way to go. I still haven't gotten anywhere near where I'm going to be, but I've made a huge amount of progress, and I still have a ways to go, but it's continuing getting better.